The first time in 12 years, the American Cancer Society is changing its breast cancer screening recommendations. And it could just add to the confusion about when women should get mammograms. CBS 2's Dr. Max Gomez sets the record straight.
Sherry Forrest had her first mammogram at age 35 after she felt a lump in her breast. Luckily, it was a false alarm.
I've gone every year since.
The American Cancer Society is now recommending women at average risk have yearly mammograms starting at age 45, not 40. Study author Dr. Kevin Offinger says the benefits far outweigh the harms starting at 45.
Between 40 and 44, breast cancer is less common. There is still the risk for a false positive, and so we thought that needs to be an informed, shared decision between the woman and her healthcare provider.
Starting at 55, the American Cancer Society recommends screenings every 2 years. That's closer to the U.S. Preventative Task Force guidelines, which recommends mammograms every 2 years starting at age 50. Some doctors say the guidelines are confusing and only take into account breast cancer deaths and not quality of life for survivors. The chief of breast screening at Lenox Hill Hospital recommends all women start yearly mammograms at age 40.
Women who develop breast cancer in their 40s, early 40s, develop a very aggressive breast cancer, and it spreads rapidly.
Sherry says she's had a few false positives in her early mammograms.
It's scary when you're waiting to find out results.
But she says she'd rather have the anxiety than cancer. And for the first time, the new guidelines support informed decision-making, saying some women ages 40 to 45 should have the option to screen early, and those over 55 to screen yearly in consultation with their doctor. So it's not a hard and fast cutoff.
So just to clarify, though, I know a lot of women are probably at home saying, well, geez, how does this affect my insurance? I mean, will my insurance still, cover the screening?
Exactly. We don't know yet because there's a good possibility that the insurance companies won't cover it because it's now a screening mammogram outside of the guidelines. The key words there are screening mammogram, because screening means you don't have any symptoms, any lump or anything. If you found a lump, that now automatically makes it a diagnostic mammogram, and that should be covered by health insurance.
And they're also recommending changes in the regular office exams with a doctor, right?
That's right. The doctor, or what's called a clinical breast exam, where the doctor examines a breast for a lump, they've evaluated all of the data on that, and they've looked at it and they said, you know what, there's not enough data to support that it really makes any difference for women having that. So they are recommending against the clinical breast exam for women.
Okay.
All right, something to definitely have a conversation with your doctor about, right?
That's the important part. You can have that conversation so that you're making that informed decision.
A lot going on. Doctor, thank you.
Thank you, Dr. Max.